Hey guys, it's Hina Sheth here at Rebalance Physical Therapy in Center City, Philadelphia, as well as on the main line in Narberth, Pennsylvania. I'm Hina Sheth. I am a pelvic floor and orthopedic physical therapist, and today I want to talk to any of you who might be having symptoms of pudendal neuralgia. And it's kind of a mouthful term, but pudendal neuralgia simply means pain along the distribution of a nerve called the pudendal nerve. Now, the pudendal nerve, it actually is a nerve that is located in the pelvis. So let me show you here on my pelvic model. So here's a model of the pelvis, okay? These are two bones called your ilium, and they come in the front and they connect to become the pubic bone. And then if you turn it into the back, there is another joint called your sacroiliac joint. And if I turn it upside down, you will see that there's a whole host of musculature that connects from these bones, from the hip, from the tailbone, and all the way around back to the pubic bone, okay? Now, if I turn this around and you look at that, this is called the pelvic floor musculature. Now, these yellow branches that you see right over here, this is a nerve, and this is called your pudendal nerve. And it basically originates in the spine, and then it starts branching out, okay, into the perineum. And there's 3 branches of the pudendal nerve, okay? And their job is to basically give function and sensation to this area of the body. So the pudendal nerve basically is responsible for giving function to the pelvic floor musculature, and I'll tell you what the pelvic floor is, what its function is. And then the other thing it does is it gives sensation to this area of the body too. So in and around, in between the sit bones, out to the sides, up into the clitoral area on a female, and through the penis in a male, and then all through in and around the rectal area as well, okay? Now, the functioning of the pelvic floor musculature is basically to control urination. It also controls vaginally in a female, it's intercourse, okay? And for both male and female, it also functions in and around for helping your, ability to have bowel movements, as well as to hold bowel movements back, okay? So that's what the function of the pudendal nerve for the pelvic floor is. And if you have any significant compromise to the pudendal nerve, then you could have symptoms that range from pain in this area, significant spasming in this area, to all the way to loss of sensation and weakness of this that can cause, incontinence issues, bowel incontinence issues, and weakness in and around the vaginal area. As well as for males, it could contribute to some of the erectile dysfunction. And again, erectile dysfunction is a whole nother case, but it could have a little bit of a role in that as well, mainly if you're having pain in addition to the erectile dysfunction. So now, most of the time, if you're especially watching this video, most of you are going to be dealing with a situation where you are experiencing more pain. Now, what can compromise, and create compression and irritation of this nerve? Well, mainly a lot of cyclists may experience, compression in and around this nerve. And when that happens, you can have all sorts of sensation changes. You can have pain in this area, and that's going to give you a lot of discomfort, especially riding a bike or even sitting. And for some of you, you may not be cyclists, but you might be sitting a lot. And us in America, we're just notorious now with desk jobs that we're sitting all the time. And so some of you, if you have the pudendal nerve that is situated and anatomically is in an area where it's getting compressed, then you might be starting to experience anything from fullness in the rectum to discomfort in the rectum, in and around the vaginal area, even into the clitoral area. And that can give you pain and discomfort in the perineum. Usually it's a sharp shooting pain that people experience when they sit. but it can also, it can be both sides. Usually it's typically one side over the other. And sometimes having a bowel movement can recreate the pain, but sitting on a toilet, because it's cut out, will actually give you relief. So the big telltale signs are I can't get my adjectives right, but a sharp shooting pain in and around the distribution of this nerve, which can be everything from, again, pubic bone all the way to the tailbone in and around the rectum, and then usually one-sided over the other. Ease with sitting on a toilet bowl or a cutout of the perineal area. And then you could also have sensation changes, tingling, numbness type sensation in this area. So some of you guys may have been Google searching and watching other YouTube videos, and you're also hearing a lot of horror stories of people saying, oh my gosh, this has ruined their life. Some of you guys might be mistaking this for what's called a pudendal nerve entrapment, and I'm going to tell you the difference between what pudendal neuralgia is as well as pudendal nerve entrapment. And again, surgeries that just, people went in and had surgery and that made them worse, or maybe it did help, and feeling like this is a lifelong issue. I want to tell some of you guys, not all of you guys, just because you're having these symptoms means that you're doomed for life. And I'm going to tell you what treatment could potentially help all of you guys. So pudendal nerve entrapment typically means that this nerve is actually entrapped between ligaments or certain types of tissue, that now this nerve, it actually needs to be surgically released, and that basically frees up this nerve. Now sometimes surgery can actually help, but sometimes and oftentimes it might not change anything or make things worse. Now that, usually I would say, you want to, if you truly know that you have pudendal nerve entrapment, which has been diagnosed by a skilled physician that truly understands pudendal neuralgia, or pudendal nerve entrapment and pudendal neuralgia, and you have had good conservative physical therapy pelvic floor treatment, okay, which I'll talk to you about what that is in a second. If you've had that and everything else has failed in terms of medication and conservative management, then I would say, okay, go to a good physician, see if this is a possibility that might be able to help. But many of you guys that are having this symptom, it might not be an entrapment at all. It might be something called a pudendal neuralgia, meaning that this nerve is irritated, but it's not physically entrapped and bogged down like in some tissue that surgically needs to be released. So why can that happen? So obviously you can see that this nerve branches into this musculature. Well, if this pelvic floor musculature for any reason is really tight, then that can cause a compression along these pudendal nerves. And that compression can basically cause irritation of this nerve. So the solution would be to release this musculature and all the tissue in and around this area. So not just the pelvic floor musculature, but the fascia that runs along this area, as well as the fascia in the back, in and around the glutes, in and around the sit bones, and in and around even the low back, the abdomen, and even in the hips. Improving that tissue can decrease the compression on this nerve, okay? And that can actually give people, along with certain types of medication, potentially even some other interventions that you might need alongside with doing the pelvic floor physical therapy treatment, okay, can really help this diagnosis get under control and hopefully even eliminated for many of you guys, okay? So I would hate for some of you guys to never have tried this treatment before, and then you go out and have surgery, and that is very hard. You can't reverse, once you've had surgery, you can't reverse what's been done. So if you haven't had this done, okay, this type of treatment, I'm going to explain to you what it is. So treating this by a skilled orthopedic as well as pelvic floor physical therapist that truly understands how to treat everything from the bones to the pelvic floor to all the tissue on the outside, that knows how to treat the fascia and perform specific connective tissue mobilization, manipulation, or release, and also understands how to work internally on this pelvic floor musculature to release it and then to help realign everything back again, is going to be that's the type of therapist that you really want to find, and that understands and treats this often and knows how to treat it well. Okay, because if you balance everything out and you release all this tissue, again, that's going to take pressure off of this nerve, and it's going to help balance everything else out. And a good skilled pelvic floor physical therapist is also going to be able to connect with this with lifestyle and educate you on what you should and shouldn't be doing, as well as be able to potentially, especially if they have a good orthopedic background, be able to connect this all the way up into the spine. And oftentimes people who have tightness in this musculature may also have other additional things that might be going on further up into even the head and neck and jaw, and all the way down potentially into the foot and ankle. So someone who understands how to also potentially connect this holistically, okay, you're even gonna, that's even more bang for your buck when you go and have this treated. Okay, so I hope that makes sense as far as what pudendal neuralgia is versus pudendal nerve entrapment, what the symptoms are, and what can be done from a conservative standpoint that might be able to help. So if you guys are watching this video and you haven't had that treatment, I would say that is the first thing that you need to do. And of course, a good pelvic floor and orthopedic physical therapist is going to be able to help you, but they're also potentially going to be able to connect you with other healthcare providers such as nurse practitioners and physicians that also understand how to treat this. And they might be able to also do almost like a collaborative treatment intervention for this, because you might not just need physical therapy, but you also might need help from a physician. But a good physical therapist is going to be able to guide you as far as who to see and help make you help make that connection for you, like we do every day in our practice. So if you have any further questions as far as trying to find a good physical therapist in your area, and you do not live in and around Philadelphia or close to us where you can come and see us, then come to our website. It's rebalancept.com. That's REBALANCEPT.com. Shoot us a contact reply and just let us know where you're at, and we'll be able to hopefully connect you with somebody in your area. And then again, if you live near us, then we would love to help you with this. So give us a call or shoot us an email or sign up for a free consultation online, especially if you're coming to see us, okay? So I hope this helps, and I hope you guys have a wonderful day. Take care.